Because of Shenandoah,
We are musician teachers for the future.
I was given the opportunity to make art I am proud of.
I've been able to treat patients in Guatemala.
This university is small for a reason. They do not believe in failure here.
Students don't come here and get lost. In fact, students come here and they get found.
Real life, real world experiences, we are the spot, we are the place to go.
To use the education that I gain at Shenandoah and then be able to impact that globally, I think that would be just really rewarding, and a life lived for others is a life worthwhile.
We're volunteering at the 2018 Winter Olympics in Pyeongchang.
And I'd love to come back and just work with them all again.
Yeah, baby!
Cirque du Soleil is in your town performing under the blue tent, and an acrobatic performer becomes injured. Who will they come to get back on the stage quickly? That health professional certified in performing arts medicine. Performing arts medicine is an emerging career where professionals from many backgrounds, physicians, physical therapists, athletic trainers, occupational therapists, chiropractors, biomechanists, and others. I don't want to really drop anyone out, but it's a group of professionals that are dedicated to preventing injuries to performing artists, to understand their specific needs in healthcare, and then to find specialized skills to get them back to their performing after, if they have sustained an injury, more rapidly. We would expect we would use our medical training from wherever we went to school, but to understand, for example, the range of motion needs of an elite ballerina, or even to understand, if I was a musician, what it's like to hold a double bass for hours during the day. It's understanding those motions and strength demands and nuances of performing arts that require a specialized area of training. The Master's Certificate in Performing Arts Medicine has several goals. First and foremost, this program was created to pay recognition to the fact that performing artists as a group have some specialized healthcare needs. So in this program, we educate students on the epidemiology of injuries to performing artists as well as disorders. We talk about risk factors of injury and disorders, and then we teach a series of assessment and treatment strategies specific to this population. We cover how performing artists move, so that's covered in a kinesiology course, and we cover nutrition needs for the performing artists, and then we make sure that we give some clinical internship time in this program, as well as time to complete a capstone project, which would be a small research project for this population. The applicants for the Master's Certificate in Performing Arts Medicine, this is an interdisciplinary program, so we are looking for health professionals who have the ability to do patient diagnosis. So therefore, medical doctors, chiropractors, licensed physical therapists, licensed occupational therapists, licensed athletic trainers, nurse practitioners, and physician's assistants. This would be the group that would be most suited for this curriculum. What's great about this program is one can continue working in their full-time job and do this program on a part-time basis. It is 15 university credits delivered across 2 years, and we deliver this primarily in an online learning environment with, across those 2 years, there are 3 mandatory on-campus weekend seminars in Shenandoah's campus. One can apply for the Master's Certificate in Performing Arts Medicine as a health professional from a country outside of the United States. The trick to that would be, from many applicants who have contacted me online, is how can I maybe not have to come to the US for those 3 seminars? And the answer is, we've got to cover that material, but we might be able to package that material so that those 3 visits are maybe done in 1 visit so that we don't have to have so much back and forth. There is potential, if there's enough students from a certain country that come, that we might be able to come to that country to actually deliver that live seminar information as well. This program has a July startup, so the program begins the first week in July every year with the first online course in terminology. Shenandoah University graduate credits at this moment are $890 a credit hour, but we have secured a discount for this program so that we offer this at $715 per credit hour. The Master's Certificate in Performing Arts Medicine has had already really nice outcomes for its graduates. We have seen graduates, for instance, physical therapists, use this specialized skill to promote their own private practices, so they may advertise in their local community that they have this specialized skill. Treat performing artists, so that they're bringing in local dancers and musicians as a new patient population that they would maybe not already have had. We've also seen some of our graduates use this training to become more competitive for job opportunities that relate to performing artists. For example, 2 of our graduates are now the head athletic trainer and the assistant head athletic trainer, respectively, for the Houston Ballet.
My name is Karina Nasrallah. I am an athletic trainer with the Houston Ballet. I am employed by Houston Methodist, which is the official healthcare provider, and we take care of the professional and student dancers here at the Center of Dance. As an athletic trainer, my specialization is orthopedics and sports medicine. So my typical day starts around 8 a.m. I arrive at the Center of Dance and I jump right into treatments for our academy students. So what that looks like is if they have a musculoskeletal complaint, something hurts, my back hurts when I do this movement and dance, I'll then make an evaluation of what we believe the underlying cause may be, what the injury is that they're dealing with. Then I'll step right into, okay, how do we address this injury? We may also use a variety of modalities, such as thermal modalities, that's your heat, your ice, your game ready, your ultrasound. We may also use a variety of manual techniques, such as massage, joint mobilizations, if we feel there's a restriction in the joint. We want to make sure that those dancers are able to move through their full range of motion. So I chose Shenandoah. They have a unique program called, it's Performing Arts Medicine Certificate that I had the option of doing in conjunction with my athletic training master's degree. And that was really what pulled me in. Yeah, I like to help people. I was a dancer myself for 12 plus years. I got my undergraduate degree in dance. So I very much came from this culture, from this art form. Therefore, it was always been very near and dear to my heart. I find my inspiration from the dancers. I see so much of myself in them. Their discipline, their hunger for knowledge, their drive to be the best that they can in this profession, in this art form. And I want to give them the skills and the knowledge that I never had as a dancer in training myself, the understanding of how their body works, how to prevent injury, to sustain their careers and optimize their performance. And so that's what brings me to work every day, is just the desire to pass along this gift and this knowledge that I've been given and to help them be the best that they can.
An additional program outcome in the PAM is that many of our students have taken their capstone research projects and have been able to present these projects nationally and internationally. We've had projects presented at the International Association of Advanced Medicine Science, as well as the Performing Arts Medicine Association and the National Athletic Trainers Association. And getting your name out there and showing advancement of research is a great way to, one, advance the PAM profession, but also perhaps improve your own credibility in the job market with this skill set. There are new programming adventures on the horizon for Shenandoah University. The PAM program lives under the Division of Athletic Training. That said, it is still an interdisciplinary program, and we have now looked at if one has taken the PAM program, we can now, if one to choose to want a Master's of Science in Education, our School of Education has a Master's of Science in Education degree with an individualized focus that if one added 12 to 14 credits on top of the PAM certificate, they could actually parlay the certificate into a full-blown master's. Additionally, we've had much feedback on, I'm interested in this curricular content, but I'm not a licensed healthcare professional. Why can't I come to this? And we've realized that we can't have, say, strength coaches and personal trainers come into a program that needs diagnosis. But what we are going to do now is create a second certificate called the Master's Certificate Performing Artist Health and Fitness. And this certificate would be open to dancers themselves, dance educators, exercise physiologists, biomechanists, perhaps personal trainers, even certified strength and conditioning coaches that want a skill set on how to prevent injuries in this population and how to put these folks on strength and conditioning programs and use nutrition to make them well or even more successful performers. So by taking the diagnosis part out and putting in the exercise content, we can now attract a new population and do that within everybody's scope of practice. This new program is currently under review at Shenandoah for approval, and we expect, with all things going accordingly, it should be ready to launch in July 2020. To make contact if interested in the PAM, if one is at a professional meeting, you're likely to find myself and my colleague, Dr. Michelle Pye, the Associate Program Director, at a marketing booth where you can speak with us directly. Additionally, if you're just trying to find us off the website, go to Shenandoah University site, www.su.edu. Look for Division of Athletic Training, and you will see the Performing Arts Medicine programming on its own page there. And certainly you can contact us for information and go from there.